The health advice was telling us, obviously, that the situation in India had become very serious. And India did so well in the first wave. We were all confident they were getting through it. Their vaccination program was good. They were even helping other countries. But it crept up on them, the second wave, a serious strain. And the medical advice tells us that when we look at how many cases we're getting in our own quarantine and where they're coming from, that was coming predominantly from India.
What's that number specifically? You know, when did it get too high? How many can we handle?
Well, it's up to the health advice to decide those things. But when they see that the main country we're getting cases from in quarantine is India, they also have to weigh up what is relevant. And what they've done there is said there'll be a temporary pause, and that's the decision the government's made. And while we're doing that pause, we're putting in place the mechanisms that will allow for travel to resume again, which means 2 negative tests. This is very important. So you'll have to get 2 separate negative tests before you board in future.
Right.
And then other mechanisms to make sure that we've got the best safety possible.
So if they're in place, could that mean no matter the scale of what's happening in India, flights can continue because the key for us is not too many positive cases, and that means we can keep taking people? Does this mean this will be the last pause and people can know they'll be able to get back after that?
Yeah, well, we'll continue to take the health advice on that. It's a serious situation in India. We've got, the world record cases every single day. We've got thousands of deaths in a day. We've got, maybe 200,000, maybe more people have died. So, that's why we're sending so much help. But the health advice will continue to inform what we do.
But if those mechanisms are good ones and they work, this could mean we don't have to pause in the future. Is that the goal here?
Yeah, well, up front we're saying there are vulnerable Australians still there. We understand that. The government understands it. The community here is telling us that, and I'll be consulting with that community in coming weeks. But with those vulnerable people, we'll be able to have charter flights and a system restored when the health advice says so, with new mechanisms.
Capability is the key. What about the Toowoomba proposal? Is there anything wrong with it?
Well, look, it's a matter for National Cabinet to continue discussing. We welcome proposals from states. However, they've got to be robust. They've got to meet the health advice. They've got to be funded. They've got to be deliverable. And everyone's got to demonstrate that. But, of course, the National Cabinet is there to ensure that we take the proper health advice. And if we have a country like India that is experiencing a very difficult outbreak, just like China at the beginning of this, just like when we had PNG and there was a very severe outbreak there, we had to shut the northern border, we've got to take steps. And I think Australians support that.
But capability is key for quarantine. It's going to continue to be. We keep having the Toowoomba proposal put up and then no specific details on what's wrong with it. I mean, if it's being purpose-built, it can be built how the federal government wants it to be. Yeah, well, is it being taken seriously?
Well, all things are taken seriously, and your industries come forward with proposals as well, but they have to be robust. They have to have...
So it's not robust at the moment?
Well, when you think about what's required with any facility, doctors, the proper health arrangements, proximity to facilities, when you go through all the logistics that go with a facility, including the security, including the cost, including the arrangements, these are very complex proposals and they do have to be robust.
Okay. The no special treatment line from Scott Morrison. So if Steve Smith gets COVID and falls quite ill, is it just a case of good luck at the Indian hospital there?
Well, no, absolutely not. We're very aware of vulnerable Australians. That's been our priority. We've returned thousands and thousands and thousands of vulnerable Australians from India and other places.
But a really sick Australian, be it a cricketer or otherwise right now in India, what can happen? I mean, they can't get here.
Well, that's right, but that's a difficult situation. Everyone's in a difficult situation. The government's put a priority on vulnerable Australians, and that's the priority we've put down through DFAT. And vulnerable people obviously are people who are pregnant, people who are elderly, people who have other illnesses or comorbidities. I think that's the right priority. I think Australians would expect us to have that priority on.
So what happens to those people right now in India?
That's what the government's working through now, how we'd be able to return flights for vulnerable people who still remain.
Right, but right now...
We have about 9,000 people registered, still 9,000 with DFAT, and vulnerable people that are within that. Right now we've had a pause because we have to put in place the arrangements. The health advice tells us to do that. But I'm now consulting myself with the Australian community about the situation for vulnerable people, and we'll work with the Australian Indian community. We'll also work to have a system of charters in place for vulnerable people as soon as we practically can with the health advice, with the proper tests and safeguards to make sure they can travel.
Part of the reason, of course, people are stuck, when you look at the overall numbers of arrivals, is that Australians have still been allowed to go overseas and return during COVID-19. Particularly a lot of attention on this case of apparently people going off for a wedding before coming back through the hotel quarantine system. Was that a mistake?
No, I don't think so. As the Prime Minister pointed out yesterday, the most important thing for people to remember is that our quarantine system has been 99.99% effective and it has worked. And even through the pandemic, we've been...
But I'm not criticising the quarantine system. What I'm asking is...
But that is also the exemption system. So the people have been going out and coming back.
Right, but what I'm asking about the priority, why that person could go off to a wedding when someone else is wanting to get home because they need to get home because they can't earn money anymore because they need to get back to Australia.
This has been a complex issue from the beginning. It's never about exactly one place versus another. It's flight availability, affordability. It has changed several times during the pandemic. So there's been parts of periods where the airline industry has virtually been at a standstill. There's been times when flights haven't been available. There's been a more normalised position come back on. It hasn't been static.
Yeah.
But what we have noticed is that we've returned more than 500,000 Australians during the pandemic have come back, and they've come back. And then we've had vulnerable people are prioritised by default. We have many, many charter flights. We had 8 charter flights planned in the month of May from India to Australia that are now off. So the government's been working at a pretty high level. People have made choices to leave. And they have
But they've been allowed to leave and come back through quarantine.
They have.
Every person that's allowed to go for a wedding and then allowed to get back means someone else doesn't. It's a zero-sum game.
I don't believe it is, and people have changed their minds in various ways overseas. People have travelled for their own reasons. Circumstances have changed. It's a very dynamic... You can't, with hundreds of thousands of offshore Australians, say there's one position.
We have a cap on hotel quarantine, so that is a zero-sum game.
That's been difficult, yeah. And the
Doesn't that make it a zero-sum game?
Well, the federal government said from the beginning that the cap on quarantine positions has been a difficult issue. States have had their own medical advice, they've made their own decisions. They've been difficult decisions, sometimes they've been harsh decisions. But collectively, Australians understand that the national cabinet system has protected Australia, kept us in the position we're in.
Okay.
And we've accepted hard decisions, even when we may not have agreed with them.
We've had recent changes of sort of priorities, so will people now not be allowed to go overseas for weddings and come back through quarantine?
Well, certainly we see the situation with India. You know, the system will be tighter in relation to that. But in terms of exemptions, we need to be able to move people for urgent reasons around the place.
Is a wedding one of them?
Well, it can be, depending on the situation. It can be.
Right,
Absolutely.
so next week someone could still go overseas,
it could be,
go
yes.
to a wedding and come back through quarantine?
Be, yes. And there can be situations, but maybe not to India in this situation at the moment.
It's an interesting priority though, isn't it? Because we're hearing all these stories of people stuck, as I said, overseas, couch surfing, can't get home, desperate to, and someone else is going to a wedding and then coming back.
Well, it's not either or, and we've made plenty of charters available in countries, and there are plenty of flights available now, and it is a difficult time.
Charters are fine, but again, we've got the cap of hotel quarantine.
Indeed. But everybody's circumstance is not the same. It's not everybody's queuing up to get back home. People have changed their minds. In the 18 months or 2 years we've been through this pandemic, the flight situation's changed, people coming and going has changed, border systems have changed. Things have changed multiple times across the course of this pandemic.
Couple of quick ones just in the future. Job shortages, you've indicated occupations could be added to the priority list. What sort of occupations?
Well, we'll take advice on that from our departments and our skills sections. I'm working through that list at the moment.
You must have an idea.
I certainly do, but I can't announce them today. But, you know, we are looking and consulting closely with regions, with industry, and those shortages that we're seeing because of the lack of movement of people are getting a bit more pronounced, and we're very open-minded to making sure people who are here can work and in those regions.
And 485 visa holders, we spoke about them last time, so students who have the right to work and it's running out while they're stuck overseas. Any progress on this?
Yeah, we'll continue to make announcements as we can. The climate is very difficult, as you know, with the Indian situation.
A lot of them in India.
A lot of them are in India.
Yeah.
So we'll have to obviously pause with the decision that we've made now.
A lot are just hoping, though, that their visa gets paused, so they have the right later on.
And the government will make further announcements about that.
So there's an announcement coming on that?
Well, we'll make them when we've made the decision. So, and I've said that before, and there's no change to that. But the change is unfortunately about the nature of the second wave and third waves we're seeing.
But again, they just want a decision on the pause of it. Would it come by the budget, or is it not going to be known by the budget?
Well, I'll make the announcement when we're ready to make the announcement. However, we can say to people we're very conscious of the issue, we're aware of it, we're working through it, but it has to be put in the priority. The priority at the moment is helping vulnerable Australians overseas. The priority is helping our friends and neighbours India with their needs and securing the Australian borders and community.